So when it comes to improving patient care and using ChatGPT as an aid, what we remember, and we go back to this again and again, is ChatGPT has access to a wide array of information, and when the user of ChatGPT queries it, right, submits a prompt, like we're about to do, what we're doing is we're asking ChatGPT to look in its vast knowledge of data, single out the matches that come along with this, and then effectively ask ChatGPT to provide subsequent context. Effectively, it's a very smart autocomplete. So here we're going to be talking about how does this work, right? When we want to simplify PTSD for a patient who has just been diagnosed, provide 3 examples with a limit of 200 words for each explanation, right? So PTSD, obviously, it's in the corpus of knowledge, right, that ChatGPT has. So we're going to ask it, right, for a simple explanation with some examples. So let's see what happens. Example 1, PTSD, or post-traumatic stress disorder, is a mental health condition that can happen after experiencing a very scary or dangerous event. It's like your mind gets stuck on that event and it keeps bothering you even when you don't want to think about it. Some common symptoms include nightmares, feeling on edge, or avoiding things that remind you of the event. For example, if you're in a car accident, you may have a hard time driving, or even being in a car because it brings you those scary memories. Now let's go to another example. All right, so let's see, imagine your brain is a computer that has trouble processing a specific file. In the case of PTSD, that file is a traumatic event that you've experienced. Your brain keeps trying to process it, but it can't move past it. This causes you to have upsetting memories, nightmares, and anxiety. Now, from a medical practitioner standpoint, right, when they're explaining a scary disease, right, or an issue to a patient, these are analogies that are maybe helpful. And let's just say that your patient, says, all right, explain this to me like I'm 5. This has become a popular way of asking to simplify things even further. They like I'm 5. Not 6 years old, not 4 years old, 5 years old. PTSD is when something really scary happens and your brain keeps thinking about it even when you don't want to. It can make you have bad dreams, feel worried, or not want to do things that remind you of the scary thing. All right, so we see that even it's vocabulary now it's a thing, right? So that's a little bit simpler. But this is how we can use, ChatGPT as an aid, right? To provide patients, right, with maybe more information in an alternate format. Now we can go to the next example, right? So let's say outline 3 treatment alternatives for COVID, keeping each explanation within 150 words. Is this information available elsewhere? Yes, right? What does ChatGPT do? Is it looks at what it knows about COVID, right? It looks at who has written about COVID in the data that it has crawled, and among what has been written, what qualifies as a treatment, and then regurgitates that information back to us. Now, we always have to be careful, right, to run this by maybe a medical professional that we trust, et cetera, right? What this is doing is it's looking at other information that has been written about, in this case, monoclonal antibodies, antiviral medications, anti-inflammatory drugs, in the context of being a treatment to COVID. It's not saying that this is necessarily the answer. It's more like this is what people are saying is the answer. Now, when we look at, let's say, the implications that this has, needless to say, well, we can consider that if ChatGPT is saying something, all that really means is that others, humans, right, have written about that thing before, right? So we go to the next example, briefly describe the causes and risk factors of bipolar disorder in 3 concise explanations, no longer than 100 words, right? So no longer than 100 words is not really necessary. Obviously, it's just a preference in our format. I would like to keep our reading to 100 words. Anything more than that is just, a lot of work. So first, right, we're going to go into, let's say, genetic factors, right, neurochemical imbalances, and environmental triggers. Okay, so could we keep asking ChatGPT, right, for more information about any scenario? Sure, right? And how we have a conversation with this, then let's say neurochemical imbalances in brain chemicals, particularly how can I treat neurochemical imbalances. Often involves a combination of pharmacological and non-pharmacological approaches. Always consult a healthcare professional. You'll see that, ChatGPT, anytime we ask it about any topic like this, right? It's healthcare, it's the most important one, right? But healthcare, finance, it's very careful to say, as an AI language model, right, I'm not really comfortable answering this. Or anything that I answer is more to be taken with a grain of salt, or just, any secondary opinion. Now, where does this come from? It comes from OpenAI's, right, trust and safety teams, right, that have decided, right, to build these into the application. But this is how, we can continue to use ChatGPT to improve patient care.